Hello, everyone. We would like to respectfully acknowledge the Interior Health is situated on the traditional, ancestral, and ceded territory of the Syilx Okanagan Nation. I would also like to acknowledge that you are joining us today from many places near and far and acknowledge the traditional owners and caretakers of those lands. I'm Michelle Smith, Regional Practice Lead for Research at Interior Health, and I welcome all our webinar guests. Welcome to the 9th Annual Okanagan Embracing Aging Month, and thank you for joining us today. Embracing Aging is co-hosted by the Institute for Healthy Living and Chronic Disease Prevention at UBC Okanagan, Interior Savings Credit Union, and Interior Health. The Embrace Aging Month was launched 9 years ago to celebrate and raise awareness about positive aging, and we have once again organized a number of educational opportunities and events during the month of March. The sessions are designed for everyone, young and old alike, and to focus on a variety of topics related to healthy aging and what ways to improve quality of life for among seniors, their family, and their family caregivers. Our goal is to inspire everyone to embrace positive aging. We'd like to let you know that the closed captioning box can be moved to your preferred place by clicking and dragging it to where you would like. To turn off the closed captioning, select Live Transcript button on the menu bar. We will have an opportunity for questions and comments at the end of the presentation, and we encourage you to type in questions or comments in the chat box during the presentation. Today's event is brought to you by Interior Health, and today's session is titled Exploring Patient Engagement, Patient Voices Network. And our speakers today are Carol Stathers. I'm adding vowels in there. Engagement Leader, Interior Health, Patient and Public Engagement for the BC Patient Safety and Quality Council. Maria Klement, Patient Partner for Patient Voices Network. And we would love to hear from you. Thank you for joining us today. And you can, if you want to put your PowerPoint up, and you can start when you are ready.
Thanks, Michelle. So we will get started. I'd like to introduce myself. I'm Carol Stathers, and I'm the engagement leader with the BC Patient Safety Quality Council, supporting the Patient Voices Network. And we have with us today Maria, who is Maria Klement. She's one of our patient partners with the Patient Voices Network. So I will just move the slides forward, and then we're going to both introduce ourselves a little further. So to start with, I would like to acknowledge that my workplace is within the ancestral, traditional, and unceded territory of the Syilx Nation, also known as the Okanagan. And Maria, would you like to do your traditional acknowledgement?
Yes, I'm Maria Klement, and I'd like to acknowledge the land that I live and play on is the traditional land of the Tanaha, which is in Nelson.
Nelson, good. Thank you very much, Maria. And the lovely lady we have on our PowerPoint slide is Sequoia. And Sequoia is from the Squamish First Nations area. And she is our knowledge keeper with the BC Patient Safety and Quality Council. And she has a really special role with us to help us on our journey towards cultural safety and humility. And she's quite a lovely lady. And I hope that those of you on the call might get a chance to meet her at some time. So Maria and I are going to just dive right into our presentation today. Some of the topics that we want to cover with you today are: what is patient engagement? What is the Patient Voices Network and who we work with? What is person and family-centered care? And Maria is amazing. She's got so many examples to share of the great work that she's been doing across the interior region as well as across the province. And also we want to share at the end how you can get involved. So if you think that this is kind of a neat volunteer opportunity, we would certainly welcome you to join us. Maria, is there anything else that we should cover besides what I've got up there?
I know, I think that covers it all.
Great, great. So what we're going to do is we want to show you a video. We can't take credit for the video because we didn't create the video, but it was done by Providence Healthcare, and it shows up some really good examples of what patient engagement is. So I'm just going to run the video and then I'll put myself on mute. The lady you're going to see right at the beginning of the video is one of our patient partners. Her name is Betty.
We've all been told what success looks like, but what does it look like for you?
Thing is the easiest thing to do. The most positive thing to do is to say, okay, What is it that I can do to maybe make a difference?
Patient and family-centered care is really about partnerships. It's partnering with our healthcare teams, with the people that we serve, and with their family members. Being able to have conversations, inviting people to the table, and problem solving together to figure out what we should be doing to serve a person.
Patients and family is the business we're in. It's the work that we do, and in my view, we have to partner with them. They need to be part of our care team. It's the only way that we can actually provide consistent and comprehensive care.
What we needed was to increase partnership and collaboration with patients and families and actually invite them to be members at the table. There's no one better to share that patient and family voice than the patients and families themselves.
I'm so glad to be able to see that healthcare professionals are actually listening to the patients and implementing their input into operations and how they do their jobs. I felt like my opinions had mattered immediately after my first meeting with them. I got a few requests for my input, and I was so surprised at how well I was received and how much they valued what I had to say. It was so refreshing. It was heartwarming.
We have patient and family partners involved throughout our organization, and I'm really proud of that. We've made huge strides in the last 3 years, and we've gone from having patient and family partners involved in a few places here and there to having them at our board level quality committee. We have them at program level quality and safety committee, strategic advisory committees, projects.
We have a new build coming up with Providence Healthcare, so with that, they will be involved. We've had them involved in some of our different patient health education materials. So if you're coming in for, say, a heart operation, we give you a pamphlet. Well, those used to be written by healthcare professionals, but now they're written in conjunction with patient partners. And they go through a committee which has patient partners on it that can say, actually, this doesn't make sense for us as the public. So maybe word it this way. And we run that back with the care providers. So it's mutually beneficial to both.
We as healthcare providers very often just lapse into terminology and jargon. We just have to remind ourselves to slow down and just make sure that everybody in the room is on the same page and understands exactly what we're talking about.
Just imagine that you're not a nurse and that you don't understand what's going on and that you're totally naive to this subject matter and what's happening, and the uncertainty is unbelievable. It's been that, us working together, getting through that we kind of get out of and think about it slightly differently.
We're looking at other opportunities to engage with patients and families to have their input into, in this case, hiring staff, and through that process identifying people that have the same kind of commitment as individuals to patient family-centered care as the organization does.
I think this is really important because a patient perspective is entirely different than the staff perspective when you're hiring people.
What really matters is your life experiences, and particularly in this case, your journey in our healthcare system.
I've learned that working with patient and family partners, they have so many hidden talents. They bring the lens of the patient and the family, but they also bring, the lens from their career, the lens from their other volunteerism, and the amount that they're willing to give is unparalleled. I've been surprised over and over again by the amount of time and commitment that people have to helping us improve our healthcare system.
I think for most of us, when we're laying on our deathbed, one of the things we would like to know is that we've actually had an opportunity, whatever that looks like, to make a difference in someone's life. And so by volunteering in the healthcare system, you may not be able to identify the actual people that you've made a difference to, but you know from the outcome that it is going to make a difference.
Okay, there we go. Let me move on to the next slide. So hopefully that gave you a little bit of an overview of what patient and family partners can bring to the table and how important they are. It's really heartwarming to hear how all the stories of how patients have been involved through that video, and Personally, from my experience, I can let you know that the patient partners that have been involved with Patient Voices Network since the beginning are incredibly appreciated and valued. So I'm going to dive right in here again. So what is Patient Voices Network? Patient Voices Network is a provincial-wide program which helps to engage the public or involve the public in healthcare planning, healthcare improvements. So Patient Voices Network is made up of about 1,300 patient partners from across the province. They are people who come to the healthcare system with an interest in helping to improve the healthcare system. We have patient partners in each area of our healthcare system. So across the interior region, just specifically our local region, we have about 300 patient partners who have joined Patient Voices and gone through our orientation and are ready to be involved in and being part of the change that's happening. So who are patient partners? This is a group of our patient partners at one of our conferences. Patient partners are anybody who has an interest in healthcare improvement, number one, can have had experience with the healthcare system. So some of our patient partners have had a lot of experience navigating the healthcare system and receiving care either personally or as a family member, supporting family members, or as a friend, neighbor, caregiver. So all sorts of different types of capacities that people come with. So who do we work with is the next question we are often asked. So these are most of our healthcare partners that we work with. So healthcare partners are individuals that work in the healthcare system. They are often part of teams that are looking at making improvements in different areas. So we may work directly with the Ministry of Health. We may work with any of the other health authorities that are listed up there, such as Interior Health. Or we also work with research organizations. And there's a couple down at the bottom called Reach BC and the BC Support Unit. The other group of people we often work with are universities. So locally in the Okanagan, we often work with UBC Okanagan. Some examples are that we have had patient partners on research committees, but also we've had patient partners come in and share what it's like to be a patient in the healthcare system for the medical program and the nursing program. And in the nursing program, we've had patient partners even go into the labs up at UBC Okanagan and almost act as practice patients for the nursing students who were either taking histories or needing to do blood pressure or listen to the lung sounds, things like that. So lots of really neat experiences for our volunteers here. So the area that we tend to work in the most, I would say, or the greatest influence of change would be making our healthcare system more person and family centered. So you might think, well, what is that? Well, person and family centered care encompasses the realm of trying to ensure our healthcare system is meeting the needs of the patients that are using it, but also treating patients with respect and dignity, providing them with the information that they need in a timely fashion to be able to make those really important decisions and helping to support them with that decision making. Participating in their care, collaborating with the healthcare teams that are working with them. And I often use my mom as an example of where she comes from. She's currently 92. And she often says to me, don't worry, Carol. She knows that I'm a nurse. She says, don't worry. She says, the doctor's going to tell me what to do. And I say, Mom, that's not really the way it works anymore. The doctor's going to sit down with you and your family, if you want us there, and talk about the care that you're receiving and find out what your wishes are. Provide you with the information you need to be able to go back and talk with your family about the decisions that you want to make regarding your care. And of course, your doctor will help to guide you, advise you, answer your questions, but really the ultimate decision is for the patient to be making the decision. So where do we go to next? We want to give you some examples of different ways that we've had patient partners involved, even locally or like in the Okanagan, across the interior region, or in BC. So one of the ways that we've had patient partners like Maria involved is in focus groups and workshops. And Maria, you got an example of a focus group that you've been involved with that you want to share?
Actually, yes. Just actually last week, I worked on the focus group for the BC Patient Safety and Quality Council. They're redoing their strategic plan, and they wanted a focus group of different patient partners across BC to look at what we think of the healthcare system and how we can improve it. They gave a bunch of questions that could help us guide us, because sometimes it's hard to understand what they want, and they had a really good facilitator. And one of the questions that they asked us was, where do you see the biggest opportunities and challenges for advancing quality of care in BC? And it was really great. We all had opportunities to speak our mind and say what we think our areas need, and it's going to be what they're going to set their strategic goals for in the next 3 years coming up.
Well, that sounds like a really good example. And that's BC-wide as well, so that's kind of neat. Another BC-wide opportunity that we've had a chance to have patient partners involved in is with the BC Centre for Disease Control. And it's funny because I think that prior to COVID, most of us, or many people in the province, may not have heard that name very often, but we certainly have heard it a lot lately. So the BC CDC looks after a lot of the information that's going out to the public in all areas of health, but specifically with COVID, they really wanted to have patient partners looking at the messaging that was coming out. So if you were to go to the BC CDC website and look at the COVID page, you will find that a lot of the information that's on there has been reviewed by a team in the Patient Voices Network. And we actually have 35 patient partners that are on that committee right now. And they're kind of on standby just to review materials as they come out, or to look at web pages to make sure that the information is clear and understandable by the general population, not too medical. So that's a really good example of how we've had people involved with respect to something as recent as COVID. So working groups and committees. Maria, got an example of a working group or a committee that you've been on?
Actually, two. I have one of the working groups actually finished a couple of months ago, and it was for interior health, and they were redesigning their webpage. And I had an opportunity to answer a bunch of questions ahead of time, along with some other patient partners, saying what we liked about, what we not so much didn't like about the old webpage, and how we thought it could improve. They took our suggestions, they made a mock-up, and then they sat down with us and said, well, this is what we were thinking of. What do you think? We had an opportunity to say what we liked, what we didn't like. And then they went away again, and the third time came back and said, here is what we think is going live. And we had a week ahead of everybody else to play with it, make some other, and they actually did make some smaller changes. And I've heard that there's been lots of good feedback coming back from the new webpage anyway.
I actually wrote an article about that, Maria. I don't know if you know that, but for our newsletter that we send out once a month, I wrote a story about the great work that your team was doing working with Interior Health. So if anybody's interested in that, there's a whole summary done of the great work that team's done on our website.
Okay. And one committee that just started, and like I told you, I live in the Nelson area, so the West Kootenays is my home place. And our regional hospital is actually in Trail. It's the Kootenay Boundary Regional Hospital. And I think we've started a PAC, which normally if you're from school thing, you're thinking of parents, but this one is actually patients. So same idea, we all meet monthly, and they wanted us to come together to try to make it more friendly, patient-centered kind of care. And it wasn't so much the bigger things, but sometimes it's the smaller things. So a couple of the changes that have happened, and it's only been a couple of months that we've been there, is they're taking down some of the posters and things sometimes, because when you come into the lobby, I don't know how everybody else finds it, but sometimes when I walk in, there's so many signages and posters and things, sometimes you get lost in the of it. So what they did is they cleaned it up, made it a bit brighter so it's nicer to come in. And one of the other things they're looking at is putting whiteboards beside patients' beds. And the intent is that the nurse who's taking care of the patient puts her name down, the doctor puts their name on, so the patient knows and even the family knows who the nurse is that's running around doing all the care. So small little things sometimes make a big difference in the PAC. So it's been great.
Oh, that's great. And that's a fairly new committee that's just started.
Yep, December was the first meeting.
Wow, you guys have done a lot of work already. That's good.
Yeah.
Kelowna General Hospital also has a similar committee. It's called a Patient and Family Centered Care Steering Committee, I think it's called. And it's been meeting actually since 2015. So it's amazing that it's been going that long. Patient Voices Network started back in late 2009. So it's probably one of our longer standing committees, which is awesome. But they've done some really neat stuff within Kelowna General Hospital. And one of the ones that I heard that they recently did was they actually did some changes to the name badges that the staff wear when they come in, so that patient partners would, or patients that are in the hospital would actually be able to see where they're from, and a little bit larger, because you know often their name badges are hidden sort of down on the side of their uniform or something like that. So yeah, so if you're in Kelowna General Hospital, check that out. See if they're using them still and what they look like. So next way that patient partners can get involved with Patient Voices Network is by attending conferences and education sessions. And one of the education sessions that we've been offering is called SANYA's, in Indigenous Cultural Competency Training. And we have had so many of our patient partners go through that training. The other one we have patient partners attend is one called Quality Forum. And our Quality Forum is an international conference that brings about 1,300 healthcare staff from across the world to Vancouver. And once a year, it's a chance for them to share really neat improvement projects that they've been working on. And it's incredibly motivating, and it's just so valuable because there is so many ways that people can get involved and learn from each other. And it's great. So what we've been doing is we've been supporting about 20 to 25 patient partners from across the province to go down and be part of those sessions, which is really nice to be able to, because a lot of the sessions are a lot of discussion. So when you have patient partners in the room, then the focus really grounds people in realizing sort of why they're making these improvements. And it really is for a better system for patients to be going through. Maria, did you have one you were going to mention? Yeah, go ahead.
I do. And just to add that I actually was selected this year to go to the Quality Forum, so I'm looking forward to it. But beginning of March, I attended an education session via Zoom similar to this, and it was on diversity, equity, and inclusion. And it was done by a group from Edmonton, and I have to say it was amazing. And one of the things I got out of it is how you identify yourself. And, you know, it seems easy to say, you know, I'm a blue-haired, older woman, white, but there is so much more to identity than just that. And it was interesting to see how, when you kind of go down to it, it's things that you're proud of, things of your heritage, all sorts of ideas. So what an opportunity to learn a little bit more about that as well.
That's a good example. Yeah. We also often will ask patient partners if they want to present with staff with the BC Patient Safety Quality Council, or patient partners are often asked to come and speak at conferences unrelated to us. So we've had patient partners speak at a variety of different conferences. Actually, it's funny because the lady that was on that video right at the start, she and I presented on IT changes at a conference down in Vancouver. So that was before the programs like the Interior Health My Health portal began. We were talking about accessing patient records. So that was really interesting. Today's presentation is another good example. Maria's been so kind to come and talk about her experiences as a patient partner. And if you look on this slide that I've got up, the fellow that's up in the top left corner in the red shirt, his name's Dwayne. He's from up north, somewhere around the Terrace area. And he was presenting at Quality Forum. That's the conference that I was just sharing with you. So there's all kinds of opportunities to be a public speaker. If that's your thing, if it's not your thing, it's totally okay. Because the neat thing about Patient Voices Network is you get to pick. You get to pick what you're involved with. So as an example, I approached Maria to see if she might want to do this with me today. And she could have easily just said no, which would have been fine. I don't think I could find anybody as good. But yeah, if you don't like speaking, don't worry about it. Don't have that worry you at all, because you don't have to volunteer for those sorts of things if you don't want to. So our next slide is a little bit about networking. So it's really neat with Patient Voices because being part of a network of 1,300 patient partners, it's nice to be able to meet other patient partners that are doing similar volunteer work to what you would be doing in the network, but it's also a neat opportunity for you to get to know healthcare staff. And Maria, I think you were going to talk a little bit about getting to know others that are on groups that you're on.
Yes, I'm part of the Patient Advisory and Oversight Committee, which is a provincial one. And we've been meeting over a year now, and it's always been via Zoom. But I have to say that they've taken networking via the Zoom quite nicely too, because you can go into these little breakout rooms and 3 and 4 of us get to sit and chit chat for about 10 minutes. And usually it's not always about the business at hand, but sometimes it's just knowing like spring is coming. What are you looking forward to in spring? And so that gives us a little bit of time to say what we like to do, what we want to fill our time with. So it's an opportunity to network, which I really do appreciate.
Neat, yeah. And often now with Zoom meetings, a lot of the start of the Zoom meetings is a chance to get to know other people on the call. So I really appreciate it as well when I get it to be part of a group that's just a small little group and I can get to know people. Within Patient Voices Network, we also have something called Connections Cafe. And what we do is we team up patient partners who choose to participate in this. So it's an optional thing that you can sign up for. But you can choose to be part of Connections Cafe, and then once a month or once every 6 weeks, you get teamed up with a patient partner somewhere in the province, and the two of you just plan to have a phone call together. Maybe if you're in the same community and it's safe to meet in person, you could do that as well. But the idea is just to get to know somebody else and learn what kind of volunteer opportunities that they've had through the network as well. And then one of the other things that we do is we host regional networking meetings. So I host them, as in I being the engagement leader in the interior region. So the engagement leaders in the other health regions do this as well. But what I do is I just set up an hour session where we can get together and talk about what's been happening across the interior region and sort of get a chance for everybody to get to know each other a little bit. So what's next? Health fairs. Health fairs, we haven't been doing these very much lately. So we're hoping that once things start to change and we can start going to things in person, we'll be putting up tables to share more information about Patient Voices. The one on the bottom left was up in Williams Lake a couple of years ago. The one in the top left corner, I'm pretty sure that one was in Kelowna at the Parkinson Rec Center. And the one on the far right side was at the West Bank First Nations. And I set up tables at the top to be able to just share information with the public. And we often ask if patient partners might want to come and join us, and kind of means more, I think, sometimes when you have somebody who's actually doing the volunteer work, talk about what it's like compared to myself as an example of saying, okay, this is what you could do if you join the network. So kind of hoping that we can get back out into the community soon and start attending some of those neat events. So lastly, I just wanted to invite anyone who's on the call to join us, sign up to be a patient partner with Patient Voices Network. And I'm just going to see if this link will work. Nope, it's not. Oh, maybe it is. Yeah, I'm going to take you to the link. And this is our website. So if you were to go to patientvoicesbc.ca, and I'll pop this into the chat box here. I'll remember to do that first before. Then you can find this section under patient partners, and you go down to become a patient partner. And in here is a list of what you need to do. So you fill out the sign up form, you sign the volunteer agreement, which is part of that form, and then you find an upcoming orientation to attend. And our orientations at this time are held by webinar, and we usually have 2 of them a month. So if this is something you're interested in doing, just pop onto the link that I'll put in the chat box, or it's patientvoicesbc.ca. And I was going to come over here to this what's happening section. And if you go down to our newsletter, in here, we will somewhere in here find our story we did on the Interior Health website. I won't go through them all and try and find it. I won't stumble along, but it's in there. So that is our website. So that comes to the end of what we wanted to share with you, but we wanted to open it up and just answer some questions and hear from who's on the call.
Thank you, Maria and Carol. So we now have time for, if you want to type any questions or comments into the chat, and we can share them with Maria and Carol. And while that's happening, that's 1,300 patient partners. That's an amazing number.
Yeah. I see in the chat box that there's a comment, just somebody was saying that the whiteboard suggestion is a really good suggestion, and that is, yeah, I think that's something that I'm seeing spreading around now. I had a family member in Penticton Hospital not long ago, and there was a whiteboard in there as well. So that was really good.
And yes, the recordings will be shared on YouTube, on the YouTube channel. Do you have the, Jaquetta, can you share the link for that? Jaquetta has the link.
I wanted to add to that, just in case, and I don't know who's listening or what your background is, but you can be as little as you want to be involved, or as much as you want to be involved. And there's opportunities that are not always just for interior health. They're very provincial wide. I've actually seen other things. Just recently, I joined the dietitian board as a patient voice going into one of the boards as well. So there's lots of opportunities depending on what you like to do, or and what your background has been in the past. If you have board experience before, they're always looking for somebody like that as well. Or if you just want to do something very simple close to home, I think every hospital, every health authority is always willing to have a patient voice list on their committees as well.
Yeah.
Yeah, I think more the better. That's great.
Yeah.
And great that there's opportunities for different types of participation, because as you were saying earlier, some people like to talk and some people don't like to talk. And
you really do get to pick and choose. Each week on Tuesday, we send out a newsletter with our new opportunities that are open. And you may find that a few weeks goes by and you don't see anything, or it might be like a year, and then all of a sudden something will go by and you'll think, oh, that's something I'm really interested in. And you get to choose, okay, is it going to be something that's really long term or something that's short? So yeah, lots of flexibility, which is nice. And the other thing too is the healthcare teams that we work with are really understanding that patient partners that are joining are volunteers. So they may not be able to attend every meeting. They may go away for a couple of months. Now we actually have one of our patient partners. She's down in San Diego for the winter, and she's still joining all of her groups because she can do it by Zoom. So, so yeah, lots of opportunities.
You have the question there. Thank you for this presentation. How do patient voices factor into integrated model of care or working with older adult mental health patients?
Yeah, that's a good question. Is it Jonah?
Yeah.
We don't create the opportunities. We just share the opportunities that our healthcare teams in the health authorities or the Ministry of Health or other organizations are leading. So when you're talking about integrated models of care, working with patients with mental health conditions, those sorts of opportunities are coming up all the time. Like I say, we don't lead them, we just share them. And our role with Patient Voices Network is to actually provide support to the patients, but also to the healthcare teams. So the healthcare teams may come to us and say, okay, I really want to this is my project and this is what I'm working on, but they want to know how the best way to engage the public would be. So that's the kind of support that we can provide. So they've already got the funding, and they've usually, or in most cases, and they've already got an idea of what they're going to do. Now they're going to figure out how are they going to do it and how can they engage the public. You're welcome.
Thank you. Yeah. And Maria, like that, I was really good to hear that that the project or the program does offer the quality forum attendance, because that's a really amazing place to share and learn. So is that the first time you've been there before?
Yes, it's going to be the first time, so I'm really looking forward to it. I used to do quality in my previous life when I worked, and so it's still, oddly enough, you can retire, but some of that stuff just stays with you no matter what.
Yeah.
Especially that, yes. And are you presenting as well? Or are you?
No, I am just going to be a fly on the wall, and I'm going to just absorb it all in.
Nice. Get to enjoy it all.
Yeah.
Yeah, that's great. That should be a good one this year. It's finally in person again, from what I understand.
Yeah, last year we had it virtually. And the previous year, COVID started just like the week after it really, things started to lock down. So, yeah.
And Marie and Carol, is there any areas where you think that there would be an interest for more? I mean, of course, probably everywhere, but is there any particular areas that you feel like more patient partners' voices would be
it's
added,
really
that maybe people don't get the word out? Like sometimes, like that's why we want to share your story today, because we want to get the information about so people know you're there and there's opportunities. Is there any places that you feel like in particular?
Michelle, it's really funny because we will have an opportunity come through. We had one recently, and it was looking at medical imaging in interior health. And I put the project all together, like the opportunity notice that went out to our patient partners. And I think we got one person put their name forward. And I thought, I would have expected when there was an opportunity to share anything about feedback on medical imaging, I would have thought we would have gotten a lot of people interested, because I think it's an area that people often have a lot to say. You're waiting a long time for treatment or diagnostic treatment. And it surprised me that we only got one person. So I can't predict. What I did do, though, is that I resent out a direct email to all of our patient partners, and I ended up with 20 people. So then I was really in trouble, because then I went back to the healthcare partner. I said, well, we had one. And then I said, I tried to promote it a little bit more, and now we have 20. So they took everybody, which was great. And they ended up hosting 2 separate focus groups so that they could, and actually they're happening today and tomorrow, so that they would be able to include as many people as possible. Some people that couldn't attend, they did interviews. So that was great. But sorry, back to your original question, Michelle, it's so hard for me to predict where we need more patient partners. I would just say that we welcome all patient partners with all kinds of experiences. Looking at the question in the chat box just about age, there's no age. We have people in our network from 16 all the way up to in their 90s, like Betty that's on that was on the video. I think she's getting close to 90, if not already there. And you don't have to have any experience, because you may be in your early 20s or 30s and you maybe have not really had any experience with the healthcare system, but maybe you have a vision on what you want it to look like if and when you or your family needs it. Or you may have had experience helping navigate the healthcare system, like me with my mom who's 92. I've helped her to navigate the healthcare system where she lives. So don't feel like you have to have a certain amount of experience as a patient. Yeah.
And I mean, I've seen cases where they're looking for perinatal. So as you're being pregnant, they're looking for those people. I'm past that age. So like it is wide range, does not matter.
Yeah. We had a real shortage of patient partners in the Kootenay boundary area. So Maria, that's Nelson as well, just to clarify. And we put together a whole sort of promotional sort of outreach, press releases and all that sort of thing. And then we ended up with about 20 or 30 more patient partners that came forward. So it was great, but we weren't getting people expressing interest in the opportunities that were coming up because there wasn't enough.
And the other thing I want to say is that you are very supported very well. They always ask you for every opportunity, what can we do to support you? And everybody has a different need than others. So don't think that it's interesting. It could be rides. It could be, I don't even know how to say it, closed captioning, different, whatever it is, they are always there to say, write down what it is that will stop you from being part of this group. And they are usually there to try to help you through it.
One good example is when everything shifted to being held virtually, then our patient partners had to figure out, okay, so how as did the healthcare staff. So most things moved to different virtual platforms like WebEx or Microsoft Teams or Zoom or something like that. But the training came right along behind that for patient partners to be able to participate. And I've even seen some cases where compensation has been provided for people to be able to have, to get internet temporarily or something like that so that they could participate. Expenses are usually covered. So if there was an in-person meeting, then don't expect to have to pay your own mileage if you have to drive to go to an event. If for Maria going to Quality Forum, her attendance, her registration's covered, her accommodation, her travel, meals, etc. All those sorts of things are covered. So you're volunteering your time with this organization. So I would say 99% of the time, your expenses that you incur are reimbursed.
Wow, that's really amazing, because I think that's not something that probably people realize is the support that's provided to you for if you want to be able to volunteer as a patient partner. That's that can really slow things down. Yeah, that's quite a barrier for other people. So if that's something you can support making happen to allow more people to do it, that's really amazing.
Yeah. We've got a quiet group. Does anybody else have any more questions?
It's like Monday afternoon.
Yeah.
Hey, that's the Friday afternoon where everybody's so quiet because they always want to start the weekend. Monday, you're supposed to be exuberated already.
It's supposed to be rested.
Yeah, that's right.
Definitely.
Well, if you have questions after, feel free to reach out to us. And if you send a message through Patient Voices, I can direct it to Maria as well if you have questions for Maria.
That sounds really great. And we have, send it, we can pass questions along as well if we get them through the Childhood Embrace Aging, and we'll share this. So any other questions before we just give some last minute information before we go on? I think we're good for now.
Okay.
Is it? Oh, wonderful. Okay. Kim Peak says, wonderful presentation. Thank you.
Kim.
Lovely Patient Voices supporter always.
Yep.
Right, Kim? Yes. So we will have, let's just, this is my first reading of the script, which is why I'm double checking all the time to make sure I do all the same points. So we want to thank Carol and Maria and everyone for attending. We encourage you all to attend other events scheduled for the Embracing Aging. And please visit our website, OkanaganEmbraceAging.com, for all events and registration. And we look forward to growing this event in the Okanagan and encourage anyone interested in supporting Embrace Aging in the future to please contact us, and contact information is available on our website. And we will be sending a link with an evaluation form where you can share feedback and suggestions for planning events in the future. And if you have any questions about contacting Maria and Carol, or questions from Patient Voices Network, let us know. We're very happy you've all joined today. And thank you so much, Maria and Carol. I've learned quite a bit today about what you're doing as well. And I have some thoughts myself with some provincial work we're doing with long-term care homes and our residents in long-term care, living long-term care, and their families. So I'll follow up with you as well after.
Sounds good.
So thank you very much.
Thank you.
Thanks, everyone.
Have a good day.
Bye.
Bye.